So we've already discussed that MRI mitigates overdiagnosis and virtually prevents underdiagnosis. So the next logical question is whether we could use the same test and apply it to a population. And I suppose the interesting comparator here would be flexible sigmoidoscopy. So in other words, screening for colorectal cancer, not with fecal occult blood, but actually by sticking a little telescope and just making sure that you haven't got polyps. I was invited to my NHS, UK NHS screen when I was 55 last year, and I went along and thankfully it was clear. But that's using a kind of once in a lifetime or once in a decade test, basically to rule out the probability of dying of colorectal cancer. MRI is a similarly complex test, but really good at ruling in and ruling out the disease that we're trying to identify. And it might be, and in fact I think it is, and I wish to test it in a trial, that an MRI scan on a man age 65, if negative, might actually mean that that man has no chance of dying of prostate cancer. Maybe we have to do it every decade. And if we were to do that in a population, we can simplify the MRI, make it a 10-minute scan, and I think we might have a viable, acceptable, non-invasive, cost-effective test.